welcome to this BNEWS special report. I'm BNEWS Director Rich Hosford. I'm joined tonight by Board of Health Chair, Dr. Ed Weiner, Board of Health Member, Dr. Wayne Saltsman, and Burlington Health Director, Susan Lumenello. And we are here to talk about the vaccine rollout, and sort of what we hope to see going forward, as so far the rollout has been slow. So I'll start with you, Dr. Saltzman. Just kind of give us a little bit of the details of the vaccine.
So, hi, Rich, and thank you very much for having me on. So, as we have all seen from the news, there has been a lot of work over the past year in developing what we have now is 2 vaccines, but many other vaccines in the works that have these 2 vaccines from Moderna and from Pfizer BioNTech that have been approved by the Food and Drug Administration under an emergency use authorization. Millions of doses have been given thus far. As folks know, these are mRNA vaccines. They use our cells' own machinery to create proteins that will create an immune response to the coronavirus to prevent COVID-19. Both vaccines, as we have seen, are extremely effective at 95%, but that's after the second vaccine is given. Both of these vaccines are in 2 doses. Moderna is a dose and then a second dose after 4 weeks, and the Pfizer BioNTech is a dose and then another dose in 3 weeks. The first dose does offer some protection, somewhere in the 50 to 60% range. It's the second dose that is the most, that really raises the effectiveness of the vaccine to the 95%. So you really need to get that second dose. And the Food and Drug Administration, the CDC, Mass DPH, our leaders are urging people, please make sure you get that second dose. People have been concerned about side effects. The side effects are the typical side effects that you would expect from a vaccine, the sore arm, for example. Some people are having more significant side effects: fatigue, headache, muscle aches. They are not getting the COVID-19 virus. They're not being infected with COVID-19 because these are not live viruses. They're just having an immune reaction, and these side effects are common. As I said, millions of doses, Rich, have been given in the United States, and really a paucity, extremely rare, serious reactions. So the abundance of people getting vaccines are doing so in a very safe way, having mild, if any, side effects, and within 14 days after the second dose are being conferred this protection, which is thought to last months. But if we all get the vaccine, as the good citizens that we are, the likelihood that we'll generate this herd immunity that everyone talks about will be huge, and hopefully we'll be able to resort to some type of normalcy. But Rich, if I could take 2 more seconds, the thing that I really want to stress is that there are many myths that are coming out with regard to promoting not getting the vaccine, the anti-vaccine proponents. And these myths really need to be busted. The vaccine is safe and effective. There are concerns about infertility. They're not true. There are other more international social media mediated myths that are not true as well. So what I really want folks to walk away with is that the vaccine is safe and effective. If you can get it, get it. Make sure you get the second dose. And of course, as we always talk about, even for folks who are getting the vaccine, we still have to do the things we have been doing for the past year and are now part of our lives. Hand washing, wearing masks, social distancing, isolating ourselves if we're ill. But vaccines are good, and more vaccines potentially on the way and being tested. But what we have now is good, safe, effective, and I really, really urge folks to get the vaccine. And if they have questions or concerns about the myths that are out there, or about the safetyness or the safety or the effectiveness of the vaccine, contact their primary care providers, or I'm happy to talk to anyone about it. I just got my second dose today.
Obviously, that's a good testament from you then. Um, and, obviously, talking about the myths, there's no government microchip in the vaccine to track and trace people. Staying with you, one more question, Dr. Saltsman. It's been about a year, almost a year since we kind of really started facing this pandemic, and we have vaccines. They're being made. Like you said, millions of doses. How extraordinary is that? The speed in which these were developed.
Amazingly extraordinary, Rich, and we've all seen the news reports. Typically vaccines take years to put out, and so because of what the norm is years to put out a vaccine, in which all of the testing and the long-term studies and all the individual smaller trials to answer other questions are have not necessarily been done here. People are concerned, oh, this really was pushed out, this wasn't tested for safety, and those things aren't true. The Food and Drug Administration took in all the information from the tens of thousands of doses that were administered for both vaccines, and looked at safety data, looked at the serious reactions, looked at all reactions. And the Food and Drug Administration said, yes, we agree. These vaccines are safe and effective. The benefit of getting these vaccines far outweighs the risks of them. While there were questions that weren't answered, they didn't study, right? They're studying now, but they didn't, when they obtained the emergency use authorization, they didn't have information on pregnancy or breastfeeding, some information on older adults, et cetera. Those things will be coming, but and there are some things for which you really do need to talk to your primary care doctor about, your obstetrician about, if there are questions under those circumstances, the circumstances that may not have been studied, but they are being studied now. But the people should not be concerned or afraid of the rapidity in which this has gone through. Very, 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 very smart people, highly regarded researchers, scientists for whom this is their life's work, have put all of their energies into creating these vaccines for us. And just the fact that we have that caliber of work behind us is really testimony to the great things that we can do for our communities. So while it has been on a much faster scale than a typical vaccine, the vaccines are safe and effective. And I welcome anyone to go onto the CDC site and take a look at the information out there, just kind of reiterating what I've already said. And can I also say, Rich, that the current CDC director, Dr. Walensky from Mass General Hospital, she's marvelous. She's just marvelous. And knowing that our Centers for Disease Control are now being led by such amazing people is further testimony to how we're moving forward thoughtfully and well in combating this virus.
Excellent. All very encouraging to hear. So now let's get a little bit more local. And I know, Susan or Ed, you've already had a couple of clinics. How have they been going?
Susan?
They've been going great, Rich. So we did first responder clinics
We did 200 first responders. Today we had our first second dose for our first responders. We're going to be continuing that this week and then also into next week. Last week we did 100 doses for our 75 plus population. We had the senior center help us out. So those seniors who had some difficulty signing up onto our website and our software were helped by the Council on Aging. Council on Aging also provided van rides to anybody who couldn't get down there. And it went really well, really smoothly. We got lots of positive feedback from our seniors on that. And we'll be doing second doses from that for them in exactly 28 days. So anyone who comes to us for their first dose will also be getting a second dose.
Right. And one of the things that, so I know you had like the first couple hundred, and then the clinic last week. I forgot what I was going to say. I know this week we did not have, you're not planning on having a clinic because of a lack of doses.
Let me answer that.
Okay.
2 weeks ago, Susan requested the Massachusetts Department of Public Health for 800 doses. She had coordinated with the high school, with the fire department, police department, even the custodial staffs, all excellent. And we're ready to go at the high school and do 800 seniors. And they delivered 100 doses to us. Last week, we asked for 800 doses again. And what happened is they never got back to us. We asked them on Thursday, what's going on? Nothing. And over the weekend, Susan emailed the Massachusetts Department of Public Health and she asked what's going on here. And they said, oh, because of the lack of vaccine, we're not going to send you, we can't send you anything this year. And they dropped it. Susan got back to them and said, wait a second. There are thousands and thousands of open slots at Fenway Park and at Gillette Stadium and other places throughout the community. And we can't get 100 doses. And Susan, they got back to you with silence. Well, we called our state representative, Ken Gordon, over the weekend. We called our state senator, Cindy Freeman, and both got back to us right away over the weekend to look into it and to see what they possibly can do. Why we, as a community with a very active Board of Health, a community with one of the largest and most outstanding medical reserve corps in the country, who've been drilling for these types of pandemic situations for more than a dozen years. How come we weren't given any dosages whatsoever? We can do it as well as or better than any of these large sites. How come other communities receive dosages who aren't half as prepared as we are? How come other communities got none? Well, this has taken on a life of its own right now. Richard Hosford wrote an article on the internet. Do you know him?
I'm familiar with work.
Which got picked up and went viral. Our state senator and our state representative have taken that and have run with it to see exactly what's going on, and they have received very little information. I urge everyone to read that article. Today, I'll be on Channel 7 from 9 at 10 and 11 because they picked it up. And we're asking the Massachusetts Department of Public Health, and we're asking the governor, how come we're ready? How come we can do it? How come we're trained and have people in place? Again, 250 volunteers, of which almost 60 or 70 are eligible to give the dosage, to give the vaccine. How come we're not getting any? So the Board of Health, Susan Lumenello, her staff, Wayne, Dr. Wayne Saltsman, and my other team members, which include Libby Wallen-Jevitz, Mary Beth Welch, and my vice chair, David McSweeney. We are all actively pursuing some answers. Just tell us what's going on. Tell us the truth and be transparent. I gotta say it the way I see it. We are ready. My friends, my neighbors, the seniors in town, everybody over 75, I want them vaccinated as soon as possible. They're our community. The Board of Health is there to serve them. And it's just horrible that we're ready to go and the seniors are ready to come. They're not ready to go to Gillette or Fenway Park, but they're ready to come here and we have no vaccine.
And, you know, you mentioned the piece that we were working, that I wrote, and you kind of just mentioned it now, but it seems like, you know, sort of a lack of, you know, communication is one of the big issues here.
What was the quote that you had today?
I think
From
Representative
one of the,
Ken Gordon said it was abysmal.
I
Is
think that says it all.
Now you mentioned the, you know, the sites that do have some openings, the Gillette, you know, Fenway. Is it, do you recommend that people try to get the vaccine there if they can get a spot?
This is Susan. If people are willing to go there, yes, we recommend they get their vaccine as soon as they can, because we cannot guarantee that we're going to have it here available locally, because we don't know and haven't been told how many doses we're going to be getting from the state. So if someone wants to move forward, they can call, they can go to mass.gov/COVID vaccine and go to the website. If they can't sign up on their own, they can call 211 for help to sign up. But one of the things that we've been hearing from our seniors is that they don't want to go to those appointments. They want to wait. They're waiting until they can come here. They want to do it locally, either whether it's with us or with a local pharmacy or a local doctor's office. They're going to wait because they don't want to travel so far. So I think that it's important to note that to have it locally, to not have it available locally may cause people not to get vaccinated as soon as they can. So we want to be able to have them vaccinated as soon as possible. And that's the plus in having the vaccine available at local boards of health. Can we do it all on our own? No, of course not. We need to have these state sites because there are so many people to get vaccinated, but we can certainly work together and add to that and have us as many entities as possible vaccinating.
Okay. I just want to back up to something you said, because actually that was the question that I forgot earlier. You know, originally it was just the website, but now there is the possibility, or there's a phone number that people can use, you know, if they're not super computer savvy, and that is 211. Just want to reiterate that for everybody watching. So, you know, if we were able to kind of get everything up and running, you know, what would be like, you know, the perfect case scenario for here in Burlington?
Susan, do you want to?
Sure. So the perfect case would be that we have it on a weekly basis at our high school on Wednesdays. That is our plan. If we can get, we figured out that the maximum we could probably do in a day is about 800 doses. So if we could get 800 doses per week, we could start vaccinating locally at the high school. Like Dr. Weiner had said, we brought on a lot of other departments to help us out as well. We have the Burlington Volunteer Reserve Corps. We also have the school nurses on board that will be available to vaccinate, and EMTs can vaccinate as well. So the fire department has committed their EMTs to vaccinating. And every day we are getting more and more people sign up for our Burlington Volunteer Reserve Corps. and on standby to vaccinate. So right now we have, I think we have about 80 people in queue now to become volunteers. So we're getting more people, more dispensers every day, and we anticipate that we will be able to do this.
Excellent. So it seems like people are stepping up and, pitching in and doing their part. So many people coming in. And maybe
Well,
Dr.
you
Saltzman.
know, Rich, if I could just say, in my tenure as chair of the board, and Ed was vice chair, we, along with Susan, put together the emergency disaster drills in which we, disseminated influenza vaccine every year. We did it in 2020 as well. We've been doing it for what, Ed, Susan, a decade, more than a decade?
More than a decade.
More than a decade. And people would come to these drills and they go, oh, okay, the town's going to give us our flu vaccine, and that's great. But what people may not realize is that these were exercises in preparation for a future need, a future infectious disease crisis in which we would need to mobilize and disseminate in a seamless, efficient, and effective manner. And so here we are. So we're when Dr. Weiner and Director Lumenello say we're ready, we're ready. We have trained our town with our medical reserve corps to do this. We have a process. We are ready to go. We can vaccinate a multitude of people. So this is what we've trained for. We're ready to do it. And I think that message, as Director Lumenello said, is really not getting across. And I think Dr. Weiner, with the work that he's done, is going to help that message get across, especially via our state representative and senator. But the town of Burlington is ready to serve and has trained to be able to do so.
right, all that drills would be flu clinics. And I guess maybe the last thing, if the vaccines start coming out from the federal government in a more efficient way, what is the rest of the state's plan? I know we're in like the first part of phase 2. Can you sort of explain to people when they might expect to be able to get a vaccine?
What is the plan? Is there a plan? That's the key here. The plan should have been local delivery. Every single business, every single nonprofit in the world knows, do it in the trenches, do it at the community level, because people understand and people get it done and people want to do things in their community. Dr. Saltzman clearly has pointed out that people don't want to drive 30, 40, 50 miles to get a vaccine when we can provide van service. These are people who are over 75. Not that they can't drive very well, they sure can, many of them, but they're 75. These are the senior people within our community. They shouldn't have to do this.
Right.
And so when I say about a plan, I have friends all over the country, some of those areas are in a different phase where people over 65 are receiving vaccine now. I don't know what the plan is.
Well, but there is certain like steps that, it's going to be.
Oh yes, the steps are online. The steps are online. You can just go on Massachusetts Department of Public Health and you can read them and see them. They're online, but temporally, I have no idea when we're going to move from one step to the other.
Yeah, the process was very well laid out by a major subgroup of the CDC called the ACIP, and they put together the phases. As Dr. Weiner has said, what perplexes me is the variability in approaching these phases per state. And I don't understand it. It hasn't been made clear to me. I know that, the governor is very pleased with how things are rolling out, but I think as Dr. Weiner just said, we haven't vaccinated 50% of the folks who are eligible for vaccination over age 75 as of today have not gotten the vaccine. And, it is all about the trenches. Just as Tip O'Neill said, all politics is local, all vaccination is local. And so there needs to be a little bit more of an understanding by the Mass DPH about about what our towns can do and what we can model to do for the state. So I echo Dr. Weiner. I would welcome a plan.
All right. Well, I think we can leave it there. We've hit the half-an-hour mark. I really appreciate you
Get the
taking.
vaccine. Get the vaccine, though.
I-
Get the vaccine and get your second dose.
I personally have not been so enthusiastically looking forward to a shot in my entire life. So I think we all want this over. We all want to be back in restaurants and, being able to see our families. So thank you very much. I'd like to thank you guys all for being here. I'd like to thank everybody who's watching, and I'm sure we'll be talking again in the future quite soon.
Thank you, Rich.
All right.
Thanks, Rich.